Assalamu alaikum. I am Dr. Saida from DOCIB clinic. Today I want to give some advice to diabetic patient who want to fast during Ramzan period. First I will tell it is very good for diabetic patient to do fasting during Ramzan. But before going for fasting they have to consult their doctor. So he will check their sugar level, cholesterol level, heart disease, anything, any kidney test. And second he will adjust their dose of medication. And third they will give some advice about their monitoring their sugar level. If everything is okay, no heart disease, then patient can go for fasting. Second, doctor need to adjust their medicine dose. Dose has to be decreased. If the patient is taking medicine before sahur time, then the dose need to be decreased and also shifted to the iftar time. And the medicine he is taking after sahur and before iftar and after iftar, it need to be decreased and it remain at the same time. If the patient is type 1 diabetic mellitus or is using insulin, then the insulin dose also need to be adjusted. If the insulin he is taking at the sahur time, it need to be decreased to 30% and need to be shifted to the iftar time. And the insulin he is taking at the iftar time, it need to be decreased to 50% and need to be shifted at the sahur time. And third thing is this sugar monitoring is also important because patient has decreased the medicine dosage, so proper monitoring of sugar is important. In the normal days we are checking our sugar 6 times a day because we are taking meals 3 times a day, but in the Ramzan we are checking our sugar 2 hours after sahur and 2 hours before iftar and 2 hours after iftar. But the first day we have decreased our dose of medication. At that day we have to check our sugar also at 1 p.m. in afternoon. If our sugar level is less than 70 milligram, then we have to go to break our fasting. Okay, so my advice for diabetic patient is this: first they have to do their blood test, everything is fine, they go for fasting. And second, medicine dose has to be decreased by their consultant. And third, they have to properly check their sugar level. Okay, thank you.